Special thanks to the people who have made the production of the American Health Journal possible, including Toshiba Medical Systems, and to viewers like you.
Arthritis is a very painful condition, and when it affects the knee, it can seriously impair mobility. There are new treatments and therapies that are helping to alleviate the pain. Dr. Alan Beyer of Hoag Memorial Hospital Presbyterian in Newport Beach tells us about knee arthritis and the range of treatments.
There are all stages of arthritis. Certainly, as soon as a person develops arthritis, their joint, and in this case the knee joint, which we're talking about today, isn't immediately turned to a knee that's completely degenerative. There are stages which one goes through where there's some early degenerative disease where the only part of the knee is involved and it's not complete loss of the cartilage, which eventually progresses onto a complete picture where the entire joint is involved and just about all the cartilage in the knee is lost. So our thrust in the last couple of years has been to try to intervene earlier, to try to not necessarily prevent, but certainly forestall the inevitable arthritic development and give the patient some function before completely replacing their knee joint. Well, I think the first part is making the diagnosis earlier. And part of that involves trying to profile patients, trying to understand who's at risk for developing arthritis later on in life. Certainly, things such as a person who's significantly overweight is a risk factor. Genetics are a significant risk factor. There certainly is a predilection for arthritis running in families. If one's mother or father developed severe arthritis in their knees, certainly one needs to be a little bit more vigilant that that possibly could happen to them. In addition, there are certain things such as alignment. People who are very bow-legged or people who are very knock-kneed are certainly more predisposed to wearing out a portion of their knee joint faster because of the fact that they're not aligned the way the body was built to be aligned, and that's going to put more stress on the area of the joint that's overloaded. Nutrition can have a factor. People who don't necessarily have enough calcium intake or are deficient in certain vitamins and or minerals can develop an arthritic process faster. And then there's the whole category of inflammatory arthritis diseases such as rheumatoid arthritis and gout, which can cause a joint to wear out sooner. And if a person develops these diseases early on, there are a lot of medications that are available now that can forestall the progression of those diseases. If someone starts to develop mechanical symptoms where they're getting some pain or catching or locking when they turn, when they ascend or descend stairs, or if they're sitting for long periods of time, those are the kind of things that make a person need to be a little bit more aggressive. So pain is certainly the single most important early indicator for someone having a problem in the joint that requires intervention. There are a lot of non-surgical things that I would embark upon with a patient before even beginning to think about surgical intervention. The conservative measures will work for a while. The success rates with most of our arthroscopic procedures probably are in the 95 to 98% successful range. Traditional knee replacement, I'd say also is today running at about a 95% good to excellent result. And we feel that our current prostheses probably last about 15 to 20 years. My goal with the total knee replacement is that a person should really only try to have one total knee replacement in their lifetime. Well, we have a program at Hoag that's called Joint Works, which is basically a dedicated program for all the patients who are undergoing total joint replacement. The nice thing about it is we have a dedicated OR staff that works on the total joint patients, dedicated nursing staff on the floor that these patients go to who are used to taking care of the issues that have evolved after patients had a total joint replacement. We're the only 5-star program in Orange County for total joint replacement and actually do more total hip and total knee replacements here than any other hospital in Orange County. So we've got it pretty much down to an art. Why did I wait so long? That's probably the single most common response we get 6 to 8 weeks after a total knee replacement. And that's because we haven't pulled the trigger on doing this person's operation immediately when they started complaining. They've typically waited a number of years and had a lot of pain, a lot of disability, a lot of decreased function. They were scared to have the total knee replacement, which is a very natural reaction. And finally, when they're in that healing phase and getting around better, with less pain, more mobility, that's the most common thing that they'll often say is, why did I wait so long?